Welcome back, Dr. Lu. How are you doing?
I'm doing fantastic. How are you?
I'm doing great too. Always amazing to see you and hear about your life journey and share life together. But today you want to talk about a chemical that is everywhere that some people might have heard of, some people might not have heard of. It's called BPA. So what can you tell us about BPA?
Okay, so Jason, I'm going to share with people what is BPA and where do they come from, okay? So you have to allow me to share. Okay, so for many people who are aware of BPA, and they know it's from the receipt of airplane ticket, and then most people know that, or from hard, water bottles. But what it is this. BPA is created as a hormone replacement for estrogen long time ago. I would say, really like over the life of the history, it's actually longer than glyphosate and Roundup. And it was used for hormone replacement, and quickly they found out it caused gallbladder disease, caused breast cancer, prostate issues. It caused a hormonal event. So they get rid of it. They can't use it pharmaceutically, and it somehow turned out in the food packaging industry. And then very soon, as you can see from this slide, it's pretty much everywhere in our life. Okay. Now people say, I don't do microwave. They don't understand a lot of water tanks has it. So if their water is from a tank, lunch boxes, this is really common now. Water bottle, baby bottle, and food containers. And then these things all go to the landfill, and they end up in the water supply, of course, into our animal agriculture. Now, these animals could be organic animals, right? So they start accumulating BPA as well. And so eventually, no matter what you eat, you're going to get some. And medically, a lot of people using IV solutions from some kind of plastic material, syringes, things that in contact with the things we use. Sport equipment, printing ink, thermal paper is a very known one, and paints and stuff. So what does BPA do? Well, it's known to go to the estrogen receptor alpha, which causes proliferation of the hormone-sensitive tissue. And it turns out lots of tissues are hormone sensitive, not just breast, prostate, uterus, ovaries. Things like even the salivary gland is sensitive to BPA. Some of the cancer behavior, the squamous cell carcinoma cells are stimulated by BPA. So a lot of people with throat cancer may potentially have high BPA as well. Now, BPA also attached to the nuclear receptor cells of the estrogen. Now, estrogen has cervical, like a membrane receptors, alpha, beta. They also have nuclear receptor. So BPA can bind to the nuclear receptor and cause DNA damage. BPA at a low dose can do all that. But if somebody have a high dose, like myself, I have been monitoring my own BPA since 2019, 20, 21st, 22nd, and recently. What I did not understand, for people that are being exposed actively, they need a higher dose of calcium D-glucarate, which I did not take. I thought I was taking adequate amount, which is about 600 milligrams. And I learned recently I bumped up to about 3,000 milligrams, which is recommended by our formulator. So when I did that, I just tested my BPA level, and it came down by half. So I would like to share with you, sometimes when you promote a regimen or something you can do, it's actually important to see the result. Okay, so I want to show you my result. Okay, somehow it's now changing the screen. Let's see, let's try it again. So we're going to go to this screen. Your screen. Okay. So somehow Jason is now going to the other screen. Okay, let's see. Let's try again.
Maybe give it a little bit of time to, it might be loading.
Okay. I'm not very like patient.
I don't know, yeah, because it might be my internet. You know, while that's waiting, let me ask you a quick question. You mentioned the estrogen receptor alpha, and then there's the beta. So I know that soy, which always gets a reputation as like binding to the estrogen, but soy actually binds to the beta, and that actually
correct.
reduces the cancer risk. Is that correct?
Absolutely, absolutely. I am actually using a fermented raw soy drink called the Halen 951.
Okay.
It's actually has been around for 30 years. It's reimbursable by health insurance companies for treatment of breast cancer. And that is completely soy.
Fascinating.
Because soy go to the beta receptor. Okay. Now,
you want to send it to me on WhatsApp? Maybe I can share it, or
let's see. So maybe what I should do is to get rid of that screen. Okay. Because somehow this thing is now going away. Okay, there we go. Let's try it again. It's gone. So let me see. I want to show people my data. Can you see it now?
There we go.
There we go. Okay, so you can see this is the environmental medicine project I'm so passionate about. You know, when the cancer diagnosis first came up, I was like, wait a minute, you know, am I now doing the right thing? So I want to show you this. This is very important. Making your enemy visible, right? This is one of the biggest one in my life. It may now be the case with other people. So this dark dot is what I measured right around October 30, you know, which is just two weeks ago. This is I measured last year. Okay. Now this number 2093 has been pretty consistent in the past 5 years. I was unable to lower it. And this is adding 3,000 milligram calcium deglucarate. And you can see it decreased by half. Now I'm going to continue, and I'm going to do it again and make sure it goes all the way to very, very low level, because BPA is now found in Europe. The European Environmental Protection Agent just talk about the level of BPA in Europe has exceeded the safety level. The European Environmental Protection Agent has somehow ignored or somehow underestimated the amount of BPA in Europe, okay? And which actually caused a problem because most of the medical equipment, many of them are from Europe. So if their level is exceeding safety level, some of these products we're using could be having high level of BPA, which is really my concern globally. But they just published that article. I can send it to anyone who is interested in reading about it. But to lower the BPA on ourselves is very empowering. And why is that? Well, BPA also causes chemotherapy resistance. For those who choose to do chemo, need to get their BPA lowered, okay? So that's just the way I see it. You know, regardless what you do, if you have cancer-causing agent living with your body, it doesn't matter if you are vegans or you are holistic, you are energetic healers. Our body do not like BPA because it is a strong environmental estrogen, okay? Now, the other thing indicate this substance could also be phthalates. Now, phthalates are the plasticizer we use in the soft plastic bottle. The BPA we use in the hard plastic bottle. So as you can see, my phthalates also lowered by almost half, from 43 to 26.66. So if you see this both decreased just by increasing the immune to 12 and the calcium deglucarate, the capsule, to 4 a day, and is significantly lowered by 50%. So that's really what I want to deliver today, is the solution is there, and you need to monitor, cut down exposure if you can. But sometimes, like I said, that picture, you don't know where you come from. It's really hard to pinpoint. We live in the plastic world, and we need to actively detoxify our body instead of just, live in a la-la land, which I have been. I have been so healthy. So in a way, I was kind of like ignoring the BPA number. So back to you, Jason.
No, that's fascinating. And yeah, I mean, sadly, I know glyphosate is going up. The other day, I'm walking around this beautiful neighborhood with horses everywhere. And what do I see? A woman like pumping that stuff. And I just said, oh, excuse me, what is that? And the horses are feeding on this grass.
Wow.
Yeah. And I said, what is that? She goes, oh, it's just some weed killer. And I was like, is it okay for the horses? She's like, as long as it dries, it's safe, she said. As long as it dries, it's safe. So it's like,
she's probably not even wearing a mask.
And she's not wearing a mask, no.
Yeah, she's getting it.
I felt like I should have told her to wear a mask, but
right, I know.
But I mean, so we know glyphosate's going up. Is BPA going up? Because I know they took it out of the cans, right? Like they're like, oh, BPA-free cans, right? But it's still in the plastic bottles, right? It's still in.
Yeah. So I have another slide that shows the BPA production is one of the highest chemical plastic use in the world. Wow. Now, I just came back from Switzerland, remember? And I in Switzerland, you stay in hotels or people's homes, the thing that really stands out is the water heater. All their water heater are plastic.
Ooh.
Every single one of them. What are those plastic? They are very hard. They're hard plastic because you can't boil water in the soft plastic. I suspect a lot of Europeans are getting it from the hard plastic they use. For the coffee maker, have you been to a hotel? The coffee maker, hot water going through the plastic.
So it's especially bad, right? I mean, it sounds obvious before I knew the science, but when you put hot water, hot substances, especially if they're acidic, right, in plastic, you're probably going to be getting BPA.
Absolutely.
If you microwave something, food.
And Jason, do you know, if you just Google how to detect BPA? I just ordered it. They give you a little swab, and then let's say you are suspicious of a water heater. You can swab it and send it in, and they can tell you if it has BPA in it.
Wow.
So no more guessing, right? Because sometimes when you guess, people get worried. Just get your house appliances together. And the one that you use every day, you really should swap it. And then don't buy, like food in a container. Like in Ashland, we actually encourage people to buy a glass container and go to the food place. They put it in your glass container. Right. Then you take it home. You eat it instead of those cardboard looking thing.
Right.
What do they code in there? They code PFAS and BPA to be, slippery, so it doesn't soak the oil.
Yeah, I mean, like that's something I always do whenever I bring food to people. It's so much extra weight, but I put everything in glass, and it's so that's what it does. It makes things slippery. It makes things not stick.
And it makes it non-stick, slippery, also oil and water resistant.
So like, and you're saying that the calcium deglucarate, it's a fat soluble thing, so that's able to take out the the BPA from our cells.
Correct. Now, people say, well, I would just take calcium deglucarate, right? What I really recommend is you take the immune detox with it.
Right.
Because when you are removing large quantity of chemical, you're going to cause glutathione deficiency internally, and that causes the immune system to be imbalanced, which is really one of the problems we're seeing in the past 4 or 5 years from the COVID event. I interviewed so many people with cancer, and some of them had vaccine, which is definitely suspicious, like myself. Some of them did not have vaccine. They also have cancer. So when we are looking at it, it's really our immune system are toxic. When it's toxic, just removing the toxin by itself doesn't really work that well. And I really want to support the body's immune system when I'm moving the toxin away. I think that's fantastic. If I didn't lower my immune, I actually accidentally lowered my immune because everybody was telling me that it's, by muscle testing, I didn't need it. So that's another thing I want to, just suggest is not that I don't believe muscle testing. I went through some of the best kinesiologists. And because when you are taking something, when you're doing muscle testing, the body may now need more, but I just took one. I just took 12. So during the muscle testing, I may not need it. Well, does it mean my body doesn't need it, right? That was a very big thing, because when you have a COVID situation, which could be vaccine, post-COVID, post-vaccine, is your immune system is no longer normal. So when you are muscle testing a dysfunctional immune system, it could be misleading. And I just really love my friends. There many of them are doing this from the best intention of their heart. But if you're dealing with a very confusing viral environment, the immune system is all over the place and toxic, it is very, very difficult to have accurate muscle testing.
Yeah,
that's just my input.
It's something that I continuously learned from you from the beginning till now, is that like the Chinese medicine, the Ayurveda, the muscle testing, all of these treatments, the traditional detoxing, like we're in a new world, unfortunately.
We are.
Like receipts, like the BPA, when you get a receipt, like don't touch that receipt, right? Whenever I get a receipt, I'm just like, oh, just throw it in the bag, right? And you mentioned like we don't have many CD-ROMs, but like CDs and like just what else was on that list? Dental
Oh my
binders.
God, dental is another one.
So if you have these dental resins that have BPA in them, and you just keep taking high dose of calcium deglucarate, you think it'll keep flushing it out? Okay.
Yeah, I will also measure them. So Jason, that's the reason I'm so confident about this issue is they measure 172 chemicals, including PFAS in my body, okay? I have 3 things. Glyphosate now is as low as it can. BPA is still in the red. Phthalates just came down from red to yellow. I suggest people measuring it. You don't have to measure it all the time, right? Just measure it once a year. I know it's inconvenient, but if you just Google, how do you measure urine BPA? You will come out with many companies now. They send you a urine kit, you pee in there, and they even measure phthalates. They don't just measure BPA. They measure all the plastics. So the Silent Spring Institute, you probably heard of Rachel Carson's book, and then Silent Spring, it's called the Silent Spring. And it's really, they even provide urine kit now for plastic measurement. But so far, the Vibrant America has offered the cheapest one. So that's what we use.
So they can reach out to you. I can give them the link to reach out to you to get that testing done.
Absolutely.
And is there any, before you get tested, is there any preparation you have to do? Because I know because if you're moving around a lot, do you want to test it? It just doesn't matter. You just want to see what you have.
It doesn't matter. You live here.
Right.
Like for me, I traveled all over the place. Right. Unless you live in one place in Mount Shasta, you never travel. Right. And you always live in, you never eat out. it's impossible. I think people should measure regardless.
So if it shows up high, that means that's what your body is releasing. So if it's releasing it, you probably have a lot in you. That's what it's showing. It's not.
It shows two things. The BPA is supposed to be a quick metabolizer, okay? But some of them are stored in the fat. So people are losing weight. They're losing a lot of BPA. The problem with BPA, you have to think about it's like estrogen. So when even the estrogen was just going through your body, it can do a lot of things right there and then. Have you ever give yourself a big dose of estrogen?
Not that I know of.
Yeah, you will feel it when you have a lots of estrogen.
Okay.
Hormones are funny things. Hormones is now the dose dependent. That's how the European Environmental Protection Agent missed it, because they are looking for the toxic dose, right? But hormones at the low dose is extremely dangerous. It's proliferative. It can stimulate a lot of the receptor activity at low dose. Hormones at a high dose could be anti-cancer. You know, your hormones are a completely different story. So BPA is a hormone. And I'm telling you, BPA is a hormone. You have to treat it as a hormone. You cannot treat it as cyanide. But cyanide, the high dose will kill you. A little bit probably just make you sick, right? So the poisons have two different kinds. One of them is dose dependent. So most people said, you know, solution by dilution. We'll dilute it, we won't feel anything. That is for one type of poison, but not for hormone-like poison. Because glyphosate, the same thing, at the low dose, it actually causes more harm. And one of the best example is tamoxifen. Have you heard of tamoxifen, which is a hormone drug for breast cancer? And they found out at high dose, it suppressed the breast cancer, okay? At low dose, it stimulates the breast cancer. I'm just telling you, that is called the biphasic effect of hormone therapy. You got to get the dose up. The low dose actually does the opposite.
So you're not suggesting having a lot of BPA in your body as opposed to a little.
No,
you have a lot.
Get rid of BPA all the time.
Right. But you're saying that like it's worse to have a low amount of BPA than it is to have a high.
That's not. I'm saying BPA need to be treated as a hormone.
Okay.
So people need to detoxify it on the daily basis.
Okay. So any amount of it is not good.
Absolutely. Yep. Absolutely. People say, "Oh, I'm low dose. I don't have to worry." The same thing with liver, with the glyphosate. We have a lot of glyphosate. 93% of people have glyphosate. And many people say, "Oh, my level is not too bad." Again, low dose of glyphosate can cause liver fatty changes at a very, very low dose. So in a way, environmental medicine, people can say, well, that doesn't work at all. What do I do? Well, you have a choice. You can detoxify on a daily basis, eat as much organic as possible, tell your neighbors proactively, and then surrender to God. That's what I do. Or you can ignore it. I'm telling people, it's not what I do, is what you need to do, okay? I'm just telling you, this is what I do. And I do believe we are going to die from something.
Right.
But if you detoxify, especially you're younger, you can avoid multi-system problem.
Sure.
And if you truly believe what the human body is made of, the human body is a vehicle. If the vehicle is poisoned, it doesn't matter how spiritually you are, you're not going to experience optimal health. And I know that's kind of like a judgmental call for me, but I've seen a lot of holistic people, if they don't address, even Louis Hay, She just recently came down with cancer. Okay, she's the most emotional,
Right.
energetic, spiritual person you know. She said, I have been detoxifying my emotions and live very healthy. And now when I have cancer, I need to look at what I'm eating. See?
She finally
So
realized.
she just came up with this like recently.
Wow.
She came down with some type of cancer.
But she needs to find
So
out about, she needs to hear about environmental toxins.
oh, absolutely. Everybody need to hear about environmental toxins. I think it's a toxins, emotional toxins, physical toxins, right? And then you do your best. That's all I can say. Again, I will never stop detoxifying or changing my journey about environmental medicine. And I think this is a wake-up call for me to discover about emotional contagion, emotional issues, which we definitely need to address. And also the dosage of calcium D-glucarate need to be higher in people they have more exposure.
Yeah, thank you. I mean, it's like we hear about like the world. There's so many things happening in the world that are just, we're on the brink of wars. But just to add another thing to it is, unfortunately, we just love our toxins. People love, that's why I love Jim Gale, right? Like this grass, growing this grass is the dumbest thing, because it's like you're showing off to your neighbors, I have all this grass, you have to mow it, and now it's just normal because you don't want to be the neighbor that has weeds. So now everybody's spraying the glyphosate. So we love the BPA, we love the plastic bottles instead of carrying around a glass bottle or metal. So sadly, and even if we don't do it, our neighbors are doing it. So that's the bad news. Is the good news is, like, thanks to Dr. Lu and a small handful of scientists and doctors, there are solutions. You can get tested. We could ignore it and wish it wasn't true, or we can face it. And then if we do that, then we can actually be very healthy. And other people, unfortunately, as you said, I know cancer is now 1 in 2 men, right? And 1 in 3 women. How much has that increased in the last 20 years?
Well, cancer, especially breast cancer and prostate, have really increased worldwide. Really describing this, there's no more organo land, because global trading, you can be getting things from China, from Europe, there's just a lots of exchange, and some of the bottles are made in China. So again, I feel the overall increase of cancer, not cancer deaths, because the treatment become more advanced as well. But the incidence. Now, let me tell you one thing, is people don't plan for having a diagnosis, right? Jason, you don't plan. So when I started doing my cancer therapy, right, I quickly discovered that's the best way to lose your wealth. Doesn't matter you have insurance or not. Doesn't matter. If you want to get really good care, you spend cash. If you want to mediocre, you spend, because, if you're in the system, it's faster, you spend less money. But if you want it to be a little bit of holistic, you have to be like out of the pocket. So I want people to know, if you really love your money, you should definitely we call detoxify your body, detoxify your emotional issues early on, and delay the diagnosis, right? Because we have people like say, well, can I 100% prevent it? Probably not. Delaying it, and I think when you are healthy, you probably go through treatment much easier without repetitive hospitalization, intensivity, of care. That will actually cut down the cost as well. So delaying diagnosis, cut down the cost of side effect. It's fantastic. You should do it. I never regret I did it for 17 years. And I know I watch my toxins, I watch my nutrition, my response to any treatment I choose will be fantastic.
Absolutely.
Yeah.
But you'll come back stronger than ever because you're going to learn more. You have your BPA is already lowered, your glyphosate's lowered. Yeah, it's amazing how that works.
It's funny. I actually feel better after discovering this emotional bag I've been carrying around. It's fantastic. It's absolutely great.
Wonderful, wonderful. Well, all the best. We're gonna keep documenting your journey.
Yes, thank you so much, Jason, for being in my life.
You too. I appreciate you so much.
Okay, have a wonderful day.
You too.